we're joined today by two, hopefully three physicians across Oregon who'll be sharing how hidden medical fees can harm their patients and why it's important for the state Senate to pass Senate Bill 539 to help rein these fees in. Please note that the physicians speaking today are doing so as individuals and with us at the Committee to Protect Healthcare, not necessarily on behalf of any employers. So we respectfully ask that you only refer to them in any of your coverage as they introduce themselves and not include employment information unless they expressly share that. So thank you in advance for being respectful of that. We were supposed to be joined by Dr. Rattan today as well. He has been called into an emergency surgery. He might be able to join at the end. And if not, Dr. Greg, who's another of our speakers, has agreed to help deliver his remarks on his behalf. So without further ado, I will introduce our first speaker, Dr. Bugas.
Hi, my name is Christine Bugas. I'm a retired emergency medicine doctor in Portland, Oregon, and I'm proud to support my colleagues in support of SB 539, legislation to combat the growing burden of surprise facility fees. Over the course of my 23 years of treating patients in the emergency department, I've seen the devastating impact of unaffordable healthcare. Patients are forced to choose between going to the doctor or paying for rent, food, or gas to put in the car to get to work. Time and time again, patients skip care entirely because of costs. And one of the biggest drivers of healthcare costs is facility fees. Here's what happens. Hospitals acquire and merge with clinics. Patients go to the hospital-owned clinic for routine care. Because that clinic is now a part of a conglomerate facility, facility fees are added to the bill. Hospitals then target low-income patients who may have to negotiate rates. Medicare and Medicaid negotiate rates of paid down. Hospitals inflate their prices up higher than the cost of healthcare delivery so that they can come out ahead financially. This is done in part through facility fees. Despite no difference in the type or the quality of care received in the hospital-owned clinic, the patient walks out with a bill inflated by a facility fee. Sometimes that fee is higher than the cost of the care itself. In Portland, the average cost of an ER visit is $1,800. The facility fee averages about 1/3 of that. Often, insurers do not pay facility fees. Patients end up paying their copay, their percentage of the charges, plus their utility fees. This adds up. There is no medical justification for these extra add-on charges, only corporate profit. The net profit for Providence Portland in 2024 is $4.1 billion. The CEO of Kaiser made a bit more than $25 million in the year 2023. The average hospital CEO pay is about $14 million a year. By contrast, 62% of Americans make $15 an hour or less. The facility fees can easily total hundreds, even thousands of dollars for a single visit. That's enough to push Oregonian families into financial crisis. 100 million Americans have medical debt. Medical bills are a leading cause of bankruptcy, according to the American Journal of Public Health. And I've met the homeless. I volunteer in the streets of Portland with Portland Street Medicine. Excuse me. 1 in 5 of the homeless have lost their homes due to medical debt. More than 3 in 4 Oregonians have reported delaying or skipping care because of cost. Half say they could not afford a $1,500 bill. Overwhelmingly and across political lines, patients express their desire for hospitals to provide clear cost estimates and easy to understand bills. They want transparency. I've treated a heart attack patient who tried to negotiate the bill with me for the cath lab that he needed acutely. When I said I did not know how much that would cost, he signed out against medical advice, got 8 steps, fell forward, and impacted his head and had to be readmitted to the ER for a brain bleed while he was having a heart attack. I also treated a 72-year-old slip and fall laceration of the arm and contusion of the head on Coumadin. Sutures were placed, CT was negative, but I wanted to admit him for a second CT in 24 hours for the possibility of a brain bleed for a patient who was anticoagulated. He refused and said he would risk it. When I checked on him in the morning, he didn't answer, so I sent the police and he was found dead on the floor. I also treated a 54-year-old gentleman, chainsaw to the abdomen, who arrived with coworkers, no advance directive. I stabilized him and admitted him to trauma surgery. He requested a meeting weeks later, furious that I had not let him die. He said he would spend the rest of his life paying the bill. Every single patient I have ever met wonders what's about to happen to them and how much it will cost. We have to do more to help families. People are heroes. They will give their lives to save their financial resources for their families. Hospital administrators, drug companies, insurers are raking in record profits. It's the patients who need the help. Facility fees only help corporate profits. Stop facility fees. Oregonians want people over profits. Listen to your constituents. Vote yes on SB 539, please. Thank you. And now, Dr. Greg.
Oh, Dr. Greg, you're still on mute.
Okay.
Yep.
Can you hear me now? Sorry about that.
Yep, no problem.
Hello, my name is Dr. Chandra Gregg. I'm a family medicine physician in Silverton, Oregon. I recently retired a few months ago, but I had been actively practicing for 30 years in this community. And in family medicine, we build long-term relationships with patients. We're the first call when they feel like something's off or they feel they need someone to guide them through their lifetime of care for themselves and their family members. That trust breaks down, however, when patients are blindsided by unexpected bills. I've had patients hesitate to schedule their annual exams and other appointments, specifically follow-ups after procedures, not because they can't, not because they don't need the care, but because they're afraid they're going to have a large bill that they cannot pay, they cannot afford it. I have worked with multiple families requesting circumcision in the hospital after delivering their babies. I've spent many years providing that care for mothers and their babies. And they're not able to afford the facility fee that is tacked on to the cost of the procedure, forcing them to seek another provider who might be willing to do the procedure in their office. But this takes quite a long time, and it's very stressful for the family. It's very undue stress on the family having to organize and travel to an extra appointment during the first 2 weeks of their baby's life when they should be focusing on bonding and feeding their baby and coming together as a family. Some families forego the procedure rather than face that financial burden and the stress of it all. I've also had female patients who are seeking sterilization procedures share with me that the facility fee was a barrier to their decision to undergo the procedure. And when they wanted to make a choice for their own health and their own body, they were forced into, deciding on another inexpensive option, or pregnancy, which can happen unexpectedly under those circumstances. Facility fees can turn simple, inexpensive procedures into major, unexpected financial setbacks. That uncertainty makes patients second guess whether they will seek that care. And in primary care, where prevention and early intervention are key, delay can mean the difference between catching something early and dealing with a more serious and more expensive health issue down the road. Oregon currently has no requirements for notifying patients about their hidden medical fees or estimated fees amounts. We need action now, especially as so many Oregonians are already struggling to make ends meet. Senate Bill 539 is about bringing predictability and transparency to the system for patients. This bill would limit facility fees from being added to routine services, ensure patients are told when fees will apply, and give us real data on how costs are being collected. 18 other states have already passed legislation to protect patients from their hidden medical fees. Oregon's leaders can take a huge step toward reducing the burden of surprise out-of-pocket fees for all Oregonians. At the end of the day, Oregonians deserve a healthcare system that supports, not punishes them for trying to stay healthy. I urge lawmakers to support Senate Bill 539 and put patients first. Thank you for listening.
Thank you, Dr. Gregg. And it seems like Dr. Rattan has not been able to join. So if you are indeed able to read his remarks, and these are on behalf of Dr. Rishi Rattan, a trauma surgeon in Portland.
I'm happy to read Dr. Rattan's remarks. He wanted to thank everyone for the opportunity to speak, and he is this trauma surgeon based in Portland. He's speaking out today on behalf of patients. He sees far too many patients who feel forced to forego necessary care because of unpredictable facility fees. Many patients he cares for are injured severely enough to require follow-up care in his clinic. The follow-up care is critical. It helps them get back to a pain-free, functional life and prevent more serious complications down the road. Without it, patients can have lifelong, debilitating consequences. Unfortunately, now too many are skipping these appointments, often because they're afraid of the financial burden. Some receive an unexpected bill for a costly facility fee on top of their other bills, then decide to skip future appointments. Others, understandably, fear them in the first place and decide to skip any follow-up altogether. Facility fees or hidden medical fees are unexpected, expensive charges patients find on their medical bills. They're often tacked on simply because an outpatient clinic is owned by a hospital system, and they can add hundreds of dollars to a single visit. Patients are almost never told about them up front. That lack of transparency is costing people and their health. One of Dr. Rattan's patients, a young construction worker helping to build residential housing that the growing city desperately needs in Portland, needed surgery after a motorcycle accident to avoid long-term disability. When he didn't show up, they called him. He mentioned fearing the cost and told the medical team he was willing to chance it, which made him forced to take the impossible choice between his health and finances. This decision may have repercussions for him for years to come and ripples out to our community as well, given how critical his work is to all of the community, especially, for example, Portland. We tried to walk him through the billing, but in the end, the fear of an unexpected charge was too much. He chose to live with the risk of pain and disability, risking the possibility of ending his career early rather than risking a financial disaster. Another patient was due for follow-up care after they'd been treated in the emergency department. Without it, the patient had significantly increased risk of complications that could make it harder for them to work. But they were too concerned about the cost of this care, even though it was necessary to their health and ability to function. And they stopped answering the calls that the medical team was placing to them. These stories aren't rare. This is happening all of the time. Dr. Rattan has patients skipping essential care in his clinic every month. This problem is made even more frustrating by the fact that these hidden medical fees don't reflect better care or more advanced treatment. They reflect a broken system that allows hospital corporations to nickel and dime patients without changing or improving the actual care patients are getting or where they're getting it. Dr. Rattan has recently spoken to 6 departments in 3 hospitals just to try and get a sense of how much the care doctor's order will cost. Even as a physician with insider knowledge of how to navigate health systems, spending hours on the phone over the past 2 weeks, Dr. Rattan still doesn't know the exact cost of his own upcoming care. He's had the privilege of being able to cancel initial appointments, shop around for best prices, and take a gamble without a final cost. But most of his patients cannot afford to do this. Oregonians, physicians, and patients alike overwhelmingly support putting an end to these surprise charges, and lawmakers should listen. It's time to pass Senate Bill 539 to protect patients, restore trust, and make healthcare accessible, not financially devastating. Thank you for listening.
Thank you so much, Dr. Gregg, for both your remarks and for delivering Dr. Rattan's remarks. And thank you so much, Dr. Bugas, as well. We'll now open it up for questions. If you have a question for either or both of the physicians, there are a few ways you can ask it. You are welcome to use the Q&A function. You can type your question in the chat, or if you prefer, you can raise your hand and I can unmute you to verbally ask your question. So we'll allow a few moments for folks to be able to type their questions or raise their hands. I had a question chatted to me. I'll put it in the chat for everyone to see and read it aloud. Hospitals opposing this type of legislation have claimed that facility fees are necessary to pay staff. How would you respond to that claim? And that's for either or both of you.
I can take that question. Healthcare providers and healthcare staff are compensated through a professional fee. Facility fees exist entirely separate from that fee, and those are tacked on as an additional charge simply because of where the care was delivered.
Thank you. I'll allow another moment for any follow-up questions. I had one more also chatted just to me, so I will share this one as well. Do you know when hospitals started charging facility fees? How long has this issue been growing? And again, that's for either of you or both.
I can take that if Dr. Bugas is deferring. Over the years, I know that this facility fee or hidden charges has been an issue for me as a professional for the majority of my time in Silverton. I don't think I was paying attention to it when I was a resident, but I do think it's been many years. I don't know the exact number of years. So hopefully that answers it in a big way. But I've been familiar with it for a very long time.
Absolutely. Thank you. We'll allow one more minute for any follow-up questions. And in the meantime, I will share that we are recording this webinar. So if you'd like a copy of the recording, please let me know. You can chat me in the Zoom or just send an email to where you RSVP'd, and I can get you a copy of the recording ASAP. But I'm not seeing any other follow-up questions right now, so we'll go ahead and conclude today's call. Thank you so much for those from the media who were able to join today. We appreciate you being here to hear from these physicians, and thank you so much to our speakers, Dr. Greg and Dr. Bugas. We appreciate your time and your advocacy on behalf of your patients and all Oregonians this morning. So thank you so much again.
You're welcome, and thank you for holding this session.
Absolutely. Have a great rest of your day, everyone. Thank you.